Hi, my name is Tina Gooding, and I'm completing my final full head to toe assessment. First, I'm going to begin by scanning the room, the back of the room. Prior to starting our video, I washed my hands. We completed and went over the patient's chief complaint, history of present illness, um, family history, surgical history, medical history, allergies, medications, completed vital signs. Also completed the Snellen chart, which is checking cranial nerve number 2. With he does wear glasses. With his glasses, he's 20/30. Without glasses, he's 20/80. Patient is awake and alert times 3 to person, place, and time. So we're going to begin with our actual physical assessment. We're just going to do like a brief overview of the patient, looking, make sure we're not having any work of breathing, we don't seem overly anxious, that our skin color is nice and pink with no noted cyanosis. We everything, like we're looking at the face, everything is symmetrical. There's no excessive drooping one side or the other. Just looking at the patient's skin, looking for any excessive, um, any lesions, any abnormal lesions, nevia, moles, such as that. All that is noted. We'll look at nail beds. No cap refill less than 3 seconds. There's no clubbing noted on that hand, which would be a sign of hypoxia. Less than 3 seconds on that side as well. No clubbing noted on that side. Okay, so first I'm going to begin with just examining the patient's scalp. I'm just going to be feeling of the scalp, looking and feeling for any excessive nodules, excessive dry skin, any lesions. None of that is noted. Next, we'll move to the ears and palpate the ears. Again, feeling for any nodules, any lesions, or any visible drainage from the ear canals. Then we're going to palpate the frontal sinus and just let me know if you have any tenderness. Okay.
None.
Right. And the maxillary sinuses.
None.
Okay. And then I'm just going to examine your eyes. I'm going to just pull your eyelids down. We're going to be looking at the sclera. Okay. Nice and pink. No excessive erythema. No dryness. Looking at the whites of his eyes, sclera is very nice and white. There is no jaundice, which would be indicative of a issue with the liver. And this was actually looking at conjunctiva, not the sclera. So next we're going to feel for the lymph nodes and just let me know if you have any tenderness. We don't want tenderness, but we're looking for tenderness or excessive swelling, which could be indicative of a infection. So pre-auricle, post-auricle, cervical, submandibular, submental, post-cervical, clavicular, and then axillary.
No.
Okay.
No.
Okay. Next, we're going to be examining, we're going to feel for temporal pulses. And then the carotid, which we're just going to check one at a time. Those are 2+, which is the finding we're looking for. Then I'm also going to auscultate. We're going to be listening for bruits. And next, we're going to look at his ear and his ear canals. We're going to be looking at the canal and visualizing the eardrum. We're going to be looking for any excessive cerebrum, if we have any redness, erythema, or excessive exudate. I'm just gonna pull up on the helix here. No erythema noted on that side. The ear canal is visualized, so nice pearly gray. The same on that side. Next, we're going to complete our hearing test, which is testing cranial nerve number 1. No, I'm sorry, cranial nerve number 8. And then also the cone of light was noted in the left side at 5 and on the right side at 7. Okay, so we're going to do the Weber and the Rhine test. So the Weber test, I'm going to place this on top of your scalp and just let me know if you hear the sound laterally, okay?
Yes.
Okay, here both sides.
Mhm.
Okay. And then we're gonna check the Rhine test, which is checking for air to bone conduction. And that should be a 2-to-1 ratio. So we can't hear any longer.
Okay. 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 Okay.
Well, that's a 2-to-1 ratio, which is the finding we're looking for. And next we're gonna do a whisper test. I'm just gonna sit behind you and whisper and you repeat it to me, okay?
Okay. 55. 65.
Very good. Okay, next we're going to examine the patient's eyes. First, we're going to look at the pupils and make sure his pupils are equal and reactive to light and accommodate. So if you'll just look forward. Okay, very good. Pupils are equal and reactive. If you'll just follow my pen line. We're looking for any nystagmus there. None was noted. And then we're going to check the 6 cardinal fields of gaze. If you'll just follow my pen line without moving your head, okay? And that's checking cranial nerves 3, 4, and 6. Right, and then next we're going to actually visualize and look in his eyes. We're looking for the red reflex, for the optic disc, and looking for any hemorrhages in the back of the eyes. And I'm just going to stabilize his head and use my opposite eye. Okay, the optic disc is visualized and there is no hemorrhage noted. Okay, next we're going to move on to his nose, and we're going to check to make sure there's no deviation in his septum. We're going to check for patency. First, I'm going to check for patency. Just take a deep breath for it. Okay. Very good. And then we're going to check cranial nerve number 1, which is smell. If you'll just close your eyes and tell me what you smell.
Rubbing alcohol.
Very good. So then we're going to actually visualize the nasal canal. Again, looking for any excessive edema, swelling, erythema. Just want to stabilize it then. Okay. The septum is midline. There's no deviation. There's no redness, erythema noted. Okay, next, we're going to go to the oral cavity, and we're going to be looking, just looking for any lesions, any excessive edema to the tonsils or uvula, and on the tongue, and looking for any swelling or excessive redness. You can just open it a little bit. Let's see, your tongue. You say ah. Okay. Visualizing the soft and hard palate. Can you raise your tongue up? We're looking for any excessive varicosities under the tongue. Can you move it side to side? Perfect. Okay. Check the gag reflex. Okay. Then it's checking cranial nerves. 9 and 12. Next, we're going to check the trigeminal nerve. So if you'll close your eyes and tell me if you feel something that is sharp or dull.
Sharp. Dull. Dull. Sharp.
Okay. So next, we're going to be listening for lung sounds. If you'll just take some deep breaths, we're listening for adventitious breath sounds. So we're listening for any rales, rhonchi, wheezing, which can be indicative of fluid or an infection in the lungs. We're going to also, at the front, we're going to check for tactile fremitus. So if you will just say 99.
99. 99. 99.
And then also we're going to be checking bronchophony and cacophony. If you'll just say E for me, okay?
E. 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 E.
Okay. Please get down that way this time. It's great. Okay, now we're just going to be listening the back for breath sounds. Just take some deep breaths. Again, we're going to be checking for tactile fremitus and we'll say 99.
99. 99. 99.
Okay. And then we're going to check for equal expansion. Equal expansion. Okay, so then next we're going to listen to our cardiac sounds. We're going to be listening for S1 and S2 and with the diaphragm, and then I'll switch to the bell and be listening for any murmurs, gallops. First, we're going to be listening for the aortic, which is the second intercostal space, right sternal border, and then the pulmonic, which is second intercostal space, left sternal border, and then Earth's point, third intercostal space, left sternal border, then the tricuspid, which is the fourth intercostal space, left sternal border, and then lastly the mitral valve, which is the fifth intercostal space, midclavicular line. If you'll just kind of lean forward, bring it horse forward. There, S1 and S2 sounds are noted with no murmurs or gallops. Okay, so next we're going to I'm gonna check for strength in his shoulders. This is checking cranial nerve number being able to move the shoulders, cranial nerve number 9. So can you do it like that? And then back and forward. Okay. Now we're going to check for strength, and you just push up against my knees. Oh, very good. All right. And then can you put your hands out like this? And we're going to check for strength this way. Push against my hands. Okay. And then push down. Okay. Strength's equal and bilaterally on both sides. And then we're going to check for range of motion. Can you put your arms out? Rotate them. Can you bend? That. And then put your hands out and rotate your wrist. Very good. Range of motion is good. Upper extremities. I think next we're going to go to the abdomen and assess the abdomen. If you could. So first we're going to start with the visual inspection. We're just looking for any visible pulsations or any abnormal bulges, which would be indicative of a hernia or aneurysm. And we're going to listen to vowel sounds first. We're going to listen in all 4 quads. Normal active vowel sounds. Next, we're going to listen to the pulses. We're going to listen to the aortic pulse, the iliac, and the femoral pulses. And listen to those. So then next, we're going to just slightly percuss the abdomen, looking for any dullness. We'll be doing this in a serpentine pattern. And then next we'll do just light palpitations. Let me know if you have any tenderness, okay? We're looking for any abnormal tenderness. And feeling for any abnormal bulges. And then next we're going to be doing deep palpitation. And then next we're going to be palpating for the liver. Take a deep breath. Right there. And now we're going to be palpating for the spleen. Now, feel the spleen, which is the finding you're looking for, if you can feel it in your nose enlarged. And feel the core of the liver, which is in a normal range there. And then we're going to try to palpate through the kidneys. Again, we don't want to fill the kidneys unless they're enlarged. Any jitters? Oh, that's hard too. Okay, so then we're just going to be looking at the patient's legs. Again, looking for any excessive edema, any abnormal lesions, nevia, discoloration. He does have areas of discoloration on his lower shins from having cellulitis at one point. We're going to check for pulses. Dorsus lateralis. Yeah. Okay. 2 plus equally. Next, we're going to check for strength in his legs. Can you raise your legs up? Can you, when you push down, you push up against them, and then push down against them. And also, we're going to check for range of motion. You're able to move your ankles well, okay? And bend your knee up, okay? Good. And then we're going to check for abduction and abduction, adduction. So we're going to rotate your hip. Okay. Okay. And the knee the same way. So, okay. Okay. Good. And we're rotate the hip in and out. Feels okay?
Yes.
Okay. If you'll go ahead and turn around to the side for me again. I'm also going to check radial pulses. Yeah, our brachial pulses. Those are all equal to 2 plus. Next, we're going to check our deep tendon reflexes. We're going to check the popliteal. Units. That's right. Remember? That's the notice that the action for me in the last thing. It's probably not like these. Right. Next, we're going to do the Romberg test. If you'll just stand up for me and just close your eyes. We're just checking to make sure that the patient does not get off balance with his eyes closed. Okay, very good. So we didn't have any imbalance there. So next, I'm just going to have you walk for me, putting heels to toes. We're checking for balance. Very good. And then you're going to walk this way on your tippy toes. And then walk back on just your heels. Very good. Okay. Let's have a seat. And then next, I'm just going to verbalize if on a male patient doing a breast exam, you would have the patient lay back, feel around the breast tissue, paying attention to the nipple area, feeling for any knots or any discharge from the nipples. Then next, to do a male genitalia exam, we would have the patient lie down in the left lateral position with a gloved hand with lubricant. Firmly press the pad of your finger against the rectum and insert your finger into the rectum feeling and sweeping for the prostate from side to side, and feeling the prostate. You're looking and feeling for any nodules, any excessive swelling, any excessive pain, and then you would rotate your finger 180 degrees in each direction, again feeling for any nodules or masses, and also like visually look at the rectum for any bleeding or hemorrhoids. You would also examine the patient's penis. You would retract the foreskin, again looking for any discharge, any redness, any ulcerations, any discomfort. You would also examine the scrotum. You would actually visualize to see if the scrotum line is equal on both sides. And then you would actually palpate the testes, feeling for any nodules in the testes or excessive pain or discomfort. For a female breast exam, you would have the patient again lay down and with two different positions with their hands at their hips and above their head, and you would palpate in circular motion the entire breast tissue from the outer to the inner, and then again palpate the nipple area and looking for discharge, for any abnormal discharge from the nipples. You would be feeling for any lumps from on the breast. You would have the patient sit up and lean forward so that you could see if there's any visible nodules or indentations, which could be indicative of a breast cancer. For the female genitalia exam, you would have the patient covered up except for just the perineal area. You would have them placed in a lithotomy position. You would do a visual exam of the outer perineal. You would look at the interlabias and outer labias, again looking for any excessive discharge or lacerations, and look at the perineal rectal area for the same. To do the pap smear, you would, of course, inform the patient what you're going to do. Try to warm up the speculum, lubricate the speculum. You would insert the speculum slowly in a downward motion until you slightly start to open up the speculum till you can visualize the cervix. Once you visualize the cervix, you'll open the speculum all the way and lock it. You can then do a very good visualization of the cervix, again looking for any ulcerations, any discharge. You would use the depending on what swab you have, a brush swab the inside of the right there at the cervix and put it in the correct container. Then as you're removing the speculum, you would slowly start removing the speculum and slowly closing it and visualizing the vaginal canal, again looking for any excessive erythema, any nodules or discharge. Then you would do a bimanual exam by placing your finger in the patient's vaginal wall and palpating the abdomen, feeling for the uterus and the ovaries. And then you would do a perirectal exam by doing that again with the clean, lubricated fingers. You would place pointer finger in the rectum, in the vaginal wall, and your next finger in the rectum, and sweep for feeling for any nodules. I believe this completes my exam. Thank you very much.